So, welcome everyone. On behalf of the Association of Spine Surgeons of India, a warm welcome to Dr. John Lonstein. Dr. John Lonstein needs no introduction as he is truly one of the legends in spine surgery, and I am honored to be given this opportunity to interview him. He, as a part of the famous Twin Cities Spine Center, has the world's oldest fellowship program, the John Moore Fellowship, that has trained over 189 fellows from all over the world over almost half a century. In fact, many of his fellows have gone on to establish their own fellowship programs and have propagated his teachings far and wide. He has over 150 peer-reviewed papers, and many of them are seminal works which have furthered our understanding of spinal deformity. He was the editor of the famous Morse textbook, the first ever comprehensive textbook on spinal deformity. He was the president of SRS in 1991 and 1992 and received the Lifetime Achievement Award from SRS in 2015. Right now, he's retired and enjoying a retired lifestyle for the last 6 years. However, the teaching and the research continues. He's currently the editor-in-chief of the Spinal Deformity Journal. So I welcome Dr. Lonstein, and without much ado, let's ask him some questions.
Just,
Doc-
Casey, you need to change that slide. We've had a fellowship program since 1972, so it's 49 years,
Oh, okay.
48 years.
49 years. So that's why I wrote the
Right.
plus sign. I did not know exact number. I knew it was more than 43. It was probably 43 when I was the fellow. But did you expect that you would achieve so much in your lifetime when you started?
No, you never can see what the future is. You can only see the present and the past. The future is unknown, so no, I couldn't expect this.
So, but did you achieve whatever you desired, or you have any regrets?
I have no I have no regrets. Obviously, some of the papers I wrote, I wish I had expanded them, but it wasn't possible in those days to expand them.
So I understand everybody knows from your accent that you're not from America and you immigrated from South Africa. And then I understand you were married and with a very young son, a newborn son at the time you immigrated from South Africa.
Correct.
Why did you choose general surgery? I see that you did 2 years of general surgery before switching to orthopedics.
Because when I left South Africa, my aim was to become a heart surgeon, a cardiothoracic surgeon. And then when I went to Boston, I did my general surgery residency, and I found that in those days, just the beginning of open heart surgery, it was you take the patient to the operating room in the morning, you do the procedure, and then because you had a problem like a leaking suture line, you take them back in the evening. So to me, orthopedics appealed to me more because you get somebody, for example, with a hand injury. It was easy to decide what was wrong with the hand, but what you did with the hand and how you reconstructed it depended on when the person you were treating was a laborer and needed a good grip, or was a musician who needed good mobility of his hand.
Were you influenced by Christian Bernard, who did the first heart transplant to get, because that was in South Africa? Was it at that time?
Correct. Yes, I was. Obviously, we all were, and I was influenced on wanting to come here and do cardiothoracic surgery.
But then you switched over to orthopedics and then you landed in
Correct.
Minnesota, in Minneapolis.
Yes.
So
Yes.
how did you meet this group? So I understand Dr. Moore
Well,
recruited you to join his practice. So how did you meet John Moore?
when I came here in 1969, Dr. Moe was the head of the spine service, We had a spine service at Fairview and at Gillette, and Dr. Winter was head at Gillette. And then when I finished my residency in 1972, Dr. Moe and Dr. Winter asked me to join them, and then we formed the Twin City Scoliosis Center.
So you were the chosen four of John Moe, the holy quartet, if I may. You can see here on in the photograph, Dr. Winter, Dr. Bradford, and Dr. Ogilvy. Dr. Moe must be having very good HR skills uh, to to have all these four great people join him into practice. All of them were once point in time SRS presidents.
I don't know how Dr. Moe chose us and how it happened, but it happened.
So what was the mission statement of the Twin Cities Spine Group? What was the aim?
We just wanted to set up a program to treat spine deformities most effectively.
So in the beginning, what were the hurdles for setting up such a program? What were the problems that you faced?
Well, we were at two sites. We were at Fairview and we were at Gillette. So one of the things was to get all the information together. And we started at Fairview. I started a database that put all the patients into the database, operative and non-operative, so we can follow them. And then that was the beginning of our record system.
So I remember you showing me those punch cards that at that time to keep a record of all these patients. Did that happen during your
Yes,
time?
yes, because in those times there was no such thing as Excel. In those times, we had to put in the information with punch cards, which were fed through the database system into the mainframe. And then if we wanted to ask any questions, they'd have to go and do the work for us. It wasn't like today where we can input the data and then ask the questions ourselves and analyze it. In those days, it all had to go through the programmers.
You have had many key contributions in literature. Um, the most famous ones have been the natural history and growth prediction of AIS, bracing, school screening. Which one of these works do you think is the most important one that is most closest to your heart?
I think the natural history study, because that's the one, natural history and bracing are the two. Firstly, bracing, we showed that bracing works, but the natural history study, because that's the one that people have found work is most useful in start putting down the basis for prediction of curve progression.
So do you think over a period of time we have had more information about uh, prediction of progression, or is this information going to change in any way in the future? Are we going to get better at it?
Yes, we are getting better at it because when I did it, all we had was a ricocine, other growth things you can measure an X-ray, menarche, and bone age, which was very, very rough. And now we're getting more clear and with better data using the Sanders information of hand, bone age, and the proximal humeral growth predictions.
So do you think these non-fusion surgeries, if we are able to predict growth better, would have some future for AIS?
Time will tell.
We don't know.
Time will tell the role of the non-fusion techniques because at the moment, it's the pendulum is swung to the fact that a lot of people and a lot of children get the non-fusion techniques who don't meet either the FDA or the IDA criteria. And we probably in the next 3 or 4 years, we'll better define who is the best candidate for non-fusion surgery. and then time will tell what the results are. In other words, does it really work?
So it's best not to jump on the bandwagon right now.
Well, if you jump on the bandwagon, you must jump on with your eyes wide open, so you collect your data and analyze the data, not only seeing what the literature says, but seeing what your data says.
The bracing, in spite of so much work done on bracing that it is effective, why hasn't it caught on so well in different parts of the world? Like even in India, it is not as common to brace.
Because it's very difficult to brace. You've got to have a physician who believes that bracing works, but more importantly, you've got to have a good orthotist who can make the appropriate brace and work with the physician to get the best results. And the other thing is, it's very, very time consuming, and it's much easier to do an operation than to brace somebody.
And in India, we don't have a school screening program. And the main problem in our country actually is that even if we have a school screening program, where do these children get referred to? You know, we don't have a knowledgeable healthcare system where they will have access. So with that in mind, what message do you have for our spine society to improve the care of spinal deformity in India? What should we be doing? We
Well,
see
if
now
you
a lot of neglected patients.
well, I don't. Do you have a system in India where children go in for annual physicals before they go to school?
No, we don't.
Well, there's a problem. If there is no system for the children to be seen on a regular basis, then there is no way for them to be detected early. The only other way you can do it is to try and get the parents more aware of scoliosis. But the trouble is, India is so large,
Correct.
and it's difficult to get the information out to the parents.
So coming to the most textbook, this was the first spinal deformity textbook, and this was one where uh, the knowledge of Dr. John Moe and all of his four disciples was spread all around the world. And you were the editor in chief of the last edition. And actually, the principles outlined in these editions are still valid today. And I've heard you say so many times to study the principles rather than the methods. These books are out of print. Will there be a new edition?
No,
There,
no, no company. There are many other textbooks now of spine deformity.
sorry,
My statement about study principles rather than methods, a
correct.
mind that can grasp the principles will develop its own methods, is not. I didn't originate that. That was originated by Dr. A. Bruce Gill in the 1940s. He was president of the AOA and the Academy, and I think in his Academy address, he presented that as the basis of his talk.
But I heard it first from you, so I'm going to always going to say it's because of you. So this fellowship program, it's one of the longest. It is the longest uninterrupted fellowship program in the world. And the first fellow here, I can see this is a picture I took in the library from the Twin Cities Center. Claudio Pedras, he was from Brazil. Is that correct? 1971.
Correct.
And you have
Correct. He came from Brazil at the same time as Ed Dawson came from Los Angeles, and they both did a fellowship.
and the program has always maintained this tradition of getting at least one foreign person to train at the center. Is that a conscious effort that you took to train people from outside North America, or it just happened?
No, we did conscious efforts when we got somebody who came to us from not from outside the US. We offered them a fellowship because we wanted to spread the word to other countries in the world. So that's why we did that.
So these many of these fellows you have had have themselves established very famous fellowship programs of their own, and many of them have gone on to become SRS presidents. So how did you cultivate a program which generated so many leaders in the field?
What we did was we just chose the best fellows that we had that applied, and then gave them the best training we could, and then that landed up them going back home and either just practicing or starting fellowship programs.
So this is one of the photographs of one of the years of the fellows. This is the farewell party where the attendings get to strangle the fellows, and here in the corner I can see you strangling Todd Albert, who later on became one of the SRS presidents a few years ago. So this is a nice tradition that you have. This is one of the surgeries I assisted you in. This, like, the implant density here is like next to nothing, and these are stainless steel rods, and this is a very inexpensive construct and very appealing for someone working in India. You know, we have a big cost constraint here. What do you have to say about these modern instrumentation with DVRs? And you know, I mean, I am myself guilty in spite of learning from you to, you know, use much higher metal density than I've seen you use. So where do you think this is heading?
Well, the thing today is that because pedicle screws are very, very valuable, but they're not. The trouble is, it becomes a technique that's used for everybody. There are many, many cases of adolescent idiopathic scoliosis that will be adequately treated by this technique, which is much lower density, which is very secure, and does exactly the same as the pedicle screws and gets a good result. But if you go to most training programs today in the United States, they're only shown how to put pedicle screws in. They're not shown how to put hooks in. You need to put in hooks even though you use pedicle screws, because if you've got a reconstructive case or a difficult case, you need alternatives. And the problem here, it goes to what is called primacy, which is the technique you first learn. For example, pedicle screws is the only technique, and that's the one you use rather than having other choices. It would be great if people varied what they use, but you go to any spine meeting today, and pedicle screws is the only fixation system you see.
This is one of the quotes by one of an fellow from Twin Cities. 1 year at the Twin Cities Scoliosis Center was enough. I personally don't think it is enough. I wish I could download your brain and, you know, ask you more questions than I already did. But but it is true that the insight or the learning that was given, I mean, that I could teach myself, is a very important lesson that you give your fellows. I'll end with one of these favorite things of sayings of yours. We call it Lonsteinisms. I'm not sure. I mean, I got this from Dr. Pera. He used to say that, oh, these things are called Lonsteinisms. But I have written quite a many of them, but this is one of my favorite. This quote, attributed to only you and no one else, has to be heard in a South African accent to get that effect. So so I would ask you to end with this. So can you read
There
it?
is never a never, and there is never an always. And remember, that is always true.
Thank you, Dr. Lonstein. Thank you very much for this interview.